good afternoon, everyone. Thank you all for tuning in. Just wanted to introduce myself quickly. I'm Charlotte Harvey, and I'm the president of the Charlotte Association of Health Underwriters. Before we get started, there are a couple things I wanted to mention. Capital Conference is coming up. Registration to attend is now open. Capital Conference will be held February 22nd through the 24th. It will be virtual this year so more people can attend. Meetings with your representatives will also be virtual, and NAHU staff will assist in making these appointments. I also wanted to mention an important piece of legislation that was signed into law recently that we all need to be paying attention to is the Consolidated Appropriations Act, and it was signed into law December 27th. The bill includes provisions on COVID relief, a ban on surprise billing, disclosure of broken compensation, and the ability for employees to roll over funds from flexible spending accounts and much more. NAHU is putting on a webinar about this tomorrow at 1 to address these provisions and what they mean from an employer and benefits perspective. Derek Ashton, he is our presenter today. He is going to be talking about the 2021 self-funded playbook. A little bit about him. He resides in Orange Park, Florida, and has worked for Medcom Benefit Solutions for 9 years. He directed Medcom's compliance and actuarial divisions for 7 years and currently serves in the strategic business development and compliance consulting role. He earned the Certified Employee Benefit Specialist designation in 2018 and also holds the Group Benefits Associate and Compensation Management Specialist designations from the International Foundation of Employee Benefit Plans. Derek enjoys helping employee benefit consultants and their clients to understand and apply complex compliance requirements in ways that reduce risk and support critical business objectives. Medcom Benefit Solutions was founded in 1983 and provided TPA services to self-funded employers for 2 decades. Today, the company offers a broad portfolio of employee benefit services, including compliance and actuarial consulting, HIPAA services, ACA reporting, and consumer-driven health plan administration and COBRA administration. So take it away, Derek.
Thank you so much, Charlotte, and thank you. I want to thank both Charlotte and Tina Willenberg also for helping to set this up today, and thank you to all of you who have taken time out of your busy schedules to join us for this lunchtime self-funded playbook review. Really excited to bring this information to you today. I'm broadcasting live from my compliance laboratory here in Florida, and we're going to talk about self-funding. We're going to provide a survey of what types of self-funded options and plans are out there, help you to consider whether self-funding is a good option for some of your clients or employers that you're working with as they look at various employee benefit options, especially as they're looking very likely to save on cost. And we want to look at the trade-off between saving on cost and what kind of compliance or other areas does the employer need to pay attention to as they look at a self-funded plan. And I really appreciate you joining us, and I'm going to provide you with whatever information and help I can in the next few minutes as we spend this time together. And so let's go ahead and take a look at the self-funded playbook and see how this can help you to strengthen your business in 2021. We've got a football theme. I don't know who's going to the Super Bowl at this point, but I hope your team wins. That's all I will say on that. And just like any good football game, you have got to have a good plan in place, a good strategy for how it's going to work. That's what we want to help you with today. Our agenda is very, very simple. We're going to, again, survey the landscape of self-funded plans. We're then going to look at the compliance and actuarial considerations and what your playbook looks like in that area. And then we're going to spend some time on Q&A. Again, I'll provide any information or helpful hints that I can today, and look forward to your questions. There is an interface on the GoToWebinar. The interface, whether you're on your phone or computer, you should see a place to add questions. And if you'll just write in any questions that you have, we'll plan to address those there at the end. Let's take a look at various types of self-funded plans and the basic self-funding concept. If you compare self-funding with a fully insured approach for medical, dental, or vision plans, you typically will have a difference in the way that risk is borne. It's really all about risk bearing. And with a fully insured plan, you have an insurance carrier involved, deep pockets, if you will, that are on the hook to cover any claims, any kind of dollar expenditure that the plan needs to make. That insurance carrier is generally going to be on the hook for that. That's part of their agreement. It's part of what they do. It's, as everyone on this call knows, what insurance is really all about. And that means that that carrier is the one that takes the hit if there is a loss, and they're the ones that make the profit if there's a gain. The employer, by and large, doesn't get that profit or loss on the plan. What they get for their employees is coverage. And all the claims are paid by the carrier. Now, when you move to a self-funded plan, all of a sudden, who's bearing the risk? Well, it's no longer an insurance carrier that's bearing the risk on those claims. It's the employer. And as you can imagine, that can be a rather scary conversation to have with one of your clients to help them to think about moving from a fully insured platform to a self-funded platform when they realize that that means they are going to be bearing the risk. And now the TPA or the carrier is going to provide what we call an ASO agreement, an administrative services only agreement. And what that means is this is not insurance, it's administrative services. The employer now is the one who is going to experience the gains or losses from the plan, from the claims that are derived from the plan. And that's going to be typically up to stop loss coverage limits if you have a stop loss policy in place. And one of the first things that we want to mention here is stop loss. There's this concept that's called partially self-funded. What that means is not only do you have a self-funded medical type of plan, you have a stop loss coverage over top of it. And with stop loss coverage, you have now brought an insurance carrier back into the equation. And what happens is that insurance carrier is going to cover claims at the high level. So the employer is still on the hook up to a certain level. And then at a certain point, we call it the attachment point. That's where the stop loss carrier now has to start to pay claims. And those stop loss arrangements generally come into two areas. One is the aggregate, so the overall claims on the plan. When those claims hit a certain amount, now the stop loss carrier has to cover the claims from that level and above on the aggregate level. But it's also individual. In most cases, you'll have individual stop loss so that if one particular individual's claims start to reach a certain level, then stop loss kicks in for that individual's additional claims from that point up. So that's just a general overview of how stop loss works. And when you have stop loss with self-funding, you now have what we call a partially self-funded plan, which is the way most employers who run a self-funded plan set up the arrangement. It's typically partially self-funded because they do have stop loss involved. And that's really part of the good news. When you bring self-funding to the table and an employer starts to think about, should we be self-funded or not? The self-funded, the stop loss aspect of this really does provide some comfort and lets them know that, yeah, if there are, billions of dollars worth of claims, at a certain point, you stop being on the hook for those claims, even though you are running a self-funded plan if you have stop loss in place. Now, when we start to talk about the differences between fully insured plans and self-funded plans, On the compliance front, this starts to look really interesting. Now, fully insured or self-funded clients should really have documents set up like wrap documents and good cafeteria plan documents. Those are just basics, kind of nuts and bolts of compliance. If they're larger in size, they need Form 5500 filing. If they have any kind of Section 125 plan in place, which almost every employer does, they have non-discrimination testing that's involved. But now that fully insured column kind of comes to an end. Their overall compliance obligations are probably about half of what you have when you compare it to self-funded clients. So with a self-funded arrangement, you add some significant compliance responsibilities, and those are in the right-hand column on your screen. You can see it's still important, actually doubly important to have wrap and cafeteria or POP documents in place to make sure the 5500s are handled and the cafeteria non-discrimination testing. But now we have another kind of non-discrimination testing. We'll talk about this a little later in the presentation. What's involved with this mysterious Section 105H NDT? You also have a new obligation when it comes to HIPAA, and we'll talk about that and how to make sure that's covered as part of your playbook. You also really have now a necessity to review plan documents carefully and make sure everything is aligned. Things out of alignment can create something that we call a coverage gap. What happens with a coverage gap is that stop loss coverage that I mentioned just a few minutes ago. All of a sudden, stop loss might not cover something because, for example, eligibility is out of alignment. And when you look at the eligibility for an individual, the stop loss carrier might say, well, according to the plan, they weren't eligible, but you let them stay on the plan anyway. Now you've got to cover that $1 million claim that they just submitted. And that's something that a review of the plan documents can help to avoid and make sure you don't have those coverage gaps. That's really critical. That's maybe the biggest takeaway from today's presentation is make sure the documents are aligned, because coverage gaps can really, really cause problems, and you don't want to experience that. As long as you make sure everything's lined up, you don't have to worry about that. So you want to review plan documents to make sure there are no gaps. PCORI fees, yeah. It's interesting that PCORI fees were supposed to expire, and last year was going to be kind of the last big year for PCORI fees, and then they renewed them for, I think 10 years at least. So PCORI fees are here to stay. That stands for Patient-Centered Outcomes Research Institute. It was put in place by healthcare reform, one of the many, many taxes that came along with healthcare reform, many increases in taxes and fees. One of them was PCORI fees. Boy, we were really hoping it would go away. Congress went ahead and renewed it. So yeah, we've got PCORI fees to deal with, and that comes down to about, it's up to probably around $3 a head now. It scales up year by year by a small amount. It started around $2. It's probably somewhere close to $3 now. I haven't checked recently, but yeah, that's going to cost some money, and you have to do a special filing on a Form 720 to the IRS once a year for those PCORI fees. And that's something that with a fully insured plan, the carrier handles it. What you'll often find with fully insured versus self-funded, there are lots of things that carriers do. When you become self-funded, it's possible that they're not doing those things anymore, but it partially depends on what kind of self-funded plan you're working with. And so let's look at some of the different kinds of plans. Here on this slide, we have what we call hybrid, or they're often referred to as level funded types of plans. Now, this type of arrangement could be fully insured. We were having this conversation maybe 6-7 years ago. I'd say most of these arrangements were fully insured, at least the ones I saw and worked with. That has really changed. I have not seen a fully insured level funded plan in a long time, probably a few years. And everyone I see nowadays is self-funded. Well, what does that mean? All those compliance obligations, all those things we talked about on that compliance slide are now in play with this hybrid level funded arrangement. The other thing that happens with these plans is they often are used by smaller employers. So it's a doorway into self-funding that is really bringing self-funding to the smaller employers through these level funded plans. And sometimes if you have a plan that it's hard to tell, is this really fully insured or is it really self-funded? Some questions to ask would be, is there an administrative services only contract, an ASO contract? Remember, ASO means this is not insurance. So that's a good hint as to whether you have a self-funded plan in place. Usually if you have ASO, you have self-funding in some capacity. Who's responsible to pay the claims? If the employer is ultimately on the hook for the claims, then you've got self-funding. And then finally, is the state insurance department regulating this plan? Generally speaking, your self-funded plans are going to be under ERISA, and they may not have so much state insurance department oversight. And typically, there are certain rules that apply to insured plans that won't apply to your self-funded plans. Now, that will vary from state to state, and I'm not expert in North Carolina state insurance law. I'm sure for those of you in the North Carolina area, you would have more familiarity with that than I do, but you want to be aware of that aspect of this. Generally, your self-funded plans are going to have less direct oversight and more of an ERISA aspect to them. Now, as we look at another option for self-funding, we have what we call captive programs or stop-loss captives. Captives are somewhat popular, and they introduce a new layer of risk management. And we've tried to illustrate this on this slide by showing at the low level, the employer is responsible for claims directly, just like any other self-funded plan. But there's a middle level of claims risk that's actually shared by all the employers in the captive. So you'll have a group of employers that have banded together under this captive arrangement. You might have 50 employers or 100 employers or 10. The numbers aren't so important. What's important is these employers are sharing that risk level so that they together are responsible for those levels of claims. And then when you hit a certain point, you usually have stop loss on top of it all, keeping all of those employers safe from those really high claims. And so it really is, it creates a sandwich basically where we've added the captive program, that middle level of risk sharing amongst a group of employers. And as the claims levels go up, you have different parties responsible for different levels of claims. It's somewhere in between the stop loss and the employer's direct responsibility. You have that middle layer, the middle of the sandwich, if you will. So again, employers that are in these captive programs, they have all of those compliance responsibilities that we talked about earlier. Then we get to another interesting animal that came out of the Affordable Care Act. Once again, as the Affordable Care Act rolled in, it created something called minimum essential coverage. And there suddenly sprung up these self-funded MEC plans. And these plans were designed just to meet the bare minimum of MEC under the ACA. And what happened is a lot of smaller employers found these to be very attractive. A lot of staffing companies, a lot of companies with a large number of lower paid employees, like restaurant and hospitality groups, they bought into these MEC plans. Many still have them. It is a fairly popular design, but you really will see a lot of smaller employers jumping on these too. And that once again sweeps some smaller employers into the whole self-funding world. And you want to watch non-discrimination concerns. I mentioned before 105H, and that can be a problem in some cases. Sometimes employers, in their effort to comply with the Affordable Care Act, they ended up violating non-discrimination rules. We saw a lot of employers that basically said, well, looking at the risk, ACA is going to hit us a lot harder than non-discrimination problems. I've seen quite a few employers that decided they were just going to go ahead, roll the dice, and let the discrimination be a problem and hope that the IRS never comes calling, because they know that the IRS will be looking at ACA and whether they offered MEC to their employees, but is less likely to be looking at the non-discrimination. So they rolled the dice that way. Not all, but some employers did take that approach and continue to today. So that's just something to be aware of. And that's part of risk management, sometimes helping the client decide where they want to take the risk and which dice they want to roll, which table in the casino they want to play at. Of course, the best rule, and as a compliance guy, I have to say this, the best rule of thumb is follow all the rules. But if it comes down to it and you have to pick one to break, a lot of them decided the non-discrimination rules would be the one to break. So there you have it. I can't say much more than that's the decision that they made. Well, some other self-funded plans, this is a surprise to a lot of folks. The fact that an HRA is actually just a really miniaturized version of a self-funded arrangement. Also a health FSA, same thing. It really is considered self-funded. Now, I've had the question asked many times, how is this self-funded when it's really employee contributions that are going into that FSA? Many of them don't have any employer contribution at all. Well, the answer is under the IRS rules, those employee contributions, first of all, they're not insurance. And secondly, the IRS rules say that they're technically treated like employer contributions, even though they came from the employee. So that's really a self-funded arrangement as well. And you have all those same compliance rules, Section 105H non-discrimination, HIPAA, all those compliance rules really apply to these plans as well. But the risk is quite a bit lower because obviously the dollars on these kinds of plans tend to be smaller and you have other safeguards in place typically. So that's a general survey all the way from your standard self-funded with stop loss, all the way through captives, hybrid plans, self-funded MECs, and these kind of miniaturized self-funded arrangements that are not insurance. All of these different plans are pretty popular, and you'll find that quite a few employers, when you get down to this level of HRA and FSA, quite a few employers are actually self-funded in some capacity for some kind of medical, dental, or vision coverage for their employees. Now, when you have the conversation with an employer about making this move, you really want to think about a few things before the conversation starts. And the first question always with self-funding, particularly when we're talking about a major move to a full-fledged self-funded health plan, you really want to think heavily about group size. The conventional wisdom is that groups under 100 lives should not consider making that move. It's not a large enough risk pool. And generally speaking, those size groups don't do well with self-funding. Now, there are exceptions. We've seen exceptions, and you might have that exceptional client. But by and large, 100 is kind of the rule of thumb, if you will, on group size. The larger the group gets, the more likely it's a good candidate for self-funding. Every now and again, we'll see a jumbo group, thousands and thousands of lives, and they'll still be fully insured. And sometimes certain parts of the country that's common. But really, most groups at that size start to think about self-funding. They start to say, why are we paying all this money to an insurance carrier when we could self-fund? And they start to make that move as they grow larger. The next thing you really want to think carefully about is group demographics. And if you have any kind of underwriting experience or background, you know the way this works is if you have a group with a lot of younger males and older females, you have a good self-funding candidate. If you have a group with a lot of older males and younger females, that's probably not a great self-funding candidate, because from a cost and claims perspective, from an underwriting perspective, older males are going to hit the plan hard, and younger females tend to hit the plan harder from a cost perspective than older females who are beyond childbearing years, for example. So those are some things to think about. What kind of group are we looking at? If you have a group that it's 100 employees and most of them are men 50 and older, don't even think about self-funding. It's probably a terrible idea unless they're all health fanatics. They're all drinking their almond milk in the morning and going out to exercise, and I mean, maybe. But by and large, group demographics are a really, really important thing to look at in a general sense. Now, the next thing to look at is really about the employer and their HR and benefits staff. If the HR and benefits staff is kind of taking a laissez-faire, hands-off approach, they're not interested in learning, if they wouldn't attend a webinar like this one, you don't probably want them to be self-funded. There's a lot of education, a lot of engagement required that the employer really needs to be ready to take on. The other thing they need to be ready to take on is risk. And as we mentioned at the beginning, this conversation is really a lot about risk and who bears the risk. If the client is risk averse and they are fearful of taking on the risk of those higher claims, you probably want to steer them away from self-funding. One critical thing to share with any employer that's looking at self-funding is this: you're going to have good years and you're going to have bad years. That's just a fact. But over time, the general drift of things, if you do self-funding right, should be toward saving significant money in most cases if it's done right. So the risk tolerance, if they can't take a bad year, if they don't have the money to deal with a bad year of claims, then don't lead them to self-funding. Keep them fully insured. It's not for them to go self-funded. But if they're ready to handle the risk and they're not afraid of it, then it really could be a great option for them to go self-funded, assuming the other box is checked. Next, look at their objectives. What are they looking to accomplish? One of the great things about a self-funded plan is you can design the plan to do the things you want it to do within certain limits or parameters, where with a fully insured plan, you're generally going to have a set of options that the insurer has selected for you. And they offer, you can pick box A, B, C, or D. But if you want to have a whole range of options, self-funding is a great way to do that, because you can really set up the plan to do what you want it to do. Again, as long as you're following all the other compliance rules along the way. And finally, and really most importantly, your available resources and partnerships. As you launch into a self-funding paradigm, what you want to do is make sure you have really good partners, like a good stop-loss carrier that you work with, a good self-funding TPA that knows what they're doing, that can do that third-party administration and the ASO aspect of the plan. Many areas, I'm not sure how it is in your neck of the woods, but in many areas we see the carriers are the ones who do that. So on one side, they work as an insurance carrier, and then on the other side, they go ahead and provide ASO services for groups that want to be self-funded, kind of play it from both sides, and that is often an option. But you want to make sure you have good partners in this area, and you want to make sure you have good compliance partners and consultants and good actuarial partnerships. We'll talk about those actuarial aspects in a minute as well. But you want to have these good partnerships, and certainly good partnerships like NAHU will play into that. NAHU actually has a self-funding certification that you can take. They have, I think, at least 2 levels of it, and would certainly be a good way to expand on what we're sharing today and grow deeper in it. So lots of options and lots of different different ways, but you want to partner up. Don't go it alone. Don't be the Lone Ranger. You want to have an army of partnerships and resources at your disposal, and really reliable ones. It's really, really critical. We've seen self-funding arrangements that go off the rails because they just don't have good resources and partnerships in place. We've seen self-funding arrangements that would have gone off the rails, but because of good partnerships, they were able to hold everything together and get through the tough times. So make sure you have that. Now let's look at the playbook in a little more detail. So you'll be conversant as you talk with employers about self-funding. You'll have a good sense of what's out there in terms of compliance and actuarial. Now, my boss actually added this slide to this presentation a while back, and he's a very direct to the point kind of guy. And if you read what he wrote on this slide, it's very good. Basically says you need to be ready to have some frank conversations and discussions with your client. Are they ready for this? And they need to be ready for the fact that their fiduciary responsibilities, their HIPAA responsibilities, and all the compliance obligations are magnified with a self-funded plan. Well, I think I've probably overmade that point at this point in time. So let's take a quick diversion and talk about actuarial for self-funded employers. Think about this. An insurance company has an army of actuaries at its disposal. Most insurance companies are going to have lots of actuaries on their staff, and those actuaries are responsible for making sure that various arrangements are set up right, that all the underwriting aspects are dealt with, all these kind of things. So you want to start as a self-funded employer or one thinking about self-funding. You might want to start with an actuary of your own, and you can hire an independent actuary to perform a feasibility study. And what the feasibility study will do is, they're usually not inexpensive, maybe several $1,000s, but it will show you that you either stand to save a lot of money or you stand to lose a lot of money with self-funding. That actuary is going to look at those past claims. It's going to do a whole study and basically tell you what things look like. If the group continues on the track that it's on, self-funding either is or is not a good idea. Maybe they break even. You don't know, but when you run that feasibility study, you now have something solid that you can present to the client and basically say, you're looking good to be self-funded, or maybe not such a great idea. And you'll have the numbers to back it up. Now, for the groups that decide to become self-funded, what do they do about COBRA rates? Well, an insurance carrier is going to make it obvious what your COBRA rates are. Whatever the insurance carrier is paid for a given level of coverage is the COBRA rate, plus 2% for administration that the law allows. You're done. It's that easy. You just look at the invoice, you add the 2%, good to go. Well, when you are self-funded, how do you arrive at that number? How do you know what the plan actually should cost people in total with employer plus employee contributions? That's where an actuary can calculate that rate, and you can have a solid number and make sure you're not overcharging people. Sometimes we see groups that basically say, we're going to take the maximum possible exposure, we're going to divide that out by the number of people, and we're going to make that the COBRA rate. That's actually not kosher with the rules and the laws that govern COBRA. You really have to come up with expected claims, and that's an actuary job or an underwriter job. And if you have access to those resources, that's going to help a lot to help the employer know with certainty what they should do with those rates. And then IBNR, what does that stand for? Incurred but not reported reserve reporting. So this is not always necessary for a self-funded plan, but it can be really helpful. It can be helpful for an actuary to perform those calculations. There's always a lag between when a claim is incurred and when it's paid. not always for every claim, but there's always a lag for at least a percentage of claims between when it's incurred and when it's paid. From a financial reporting standpoint, all of a sudden the accountants and the CFOs want to know that number and want to know what they can expect to be hit with in what's been incurred but not yet paid, not yet financially reported. They want that number. And especially if you have any clients that are publicly traded, so they're on the stock market, those you want to make sure you have an actuary run the IBNR, maybe even on a quarterly basis, so that they can turn in their accounting reports to the SEC and make sure that they stay on the right track and don't run into any trouble. Also, if you have a larger client, maybe a Big Four accounting background, CFO, it's possible that that client wants to have an actuary run the IBNR. And so those can be helpful too from the actuarial perspective. And finally, what do you do from year to year budgeting and cost projecting? How do you know whether the plan's on track? How can you predict what the next year holds? An actuary can help with that. And the beauty of that is that then helps you to determine what's the level of stop loss that we should put in place. It can be a really, really helpful thing to have. Lots of good numbers in one of those cost projection reports. So an actuary can help in a lot of ways. If you're going to take a client self-funded, one of the best ways I've seen to do this is I've seen where a broker will basically come up with a consulting fee. Maybe it's $10,000, $15,000 a year, but it's tagged to actuarial and compliance, and basically making sure that the actuarial and compliance needs of the client are met. So that is one way to do it, and it seems to work pretty well in cases that I've observed. So there are some actuarial helpful hints that you'll want to be aware of. And again, good partnerships with a good actuary on your side can really make the difference, can make a night and day difference for a self-funded employer. Let's talk about Form 5500. Just want you to know that self-funded plans are not exempt from Form 5500 requirements, but in most cases, they're exempt from the Schedule A or Schedule C filing requirements. So what does that mean? They file a Form 5500, but without all the details that you'd have to file with a fully insured plan. Now, sometimes they'll file a Schedule C. I certainly have met a lot of brokers that say, better safe than sorry. We want to go ahead and file the Schedule C and give those details, including our consulting fees. But most compliance consultants that I know are going to say you don't really have to file that Schedule C or Schedule A, certainly, because Schedule A is about insurance. Schedule C is about what you pay to service providers. And again, there are various exemptions for self-funded plans. By and large, we're going to conclude that you don't have to file those schedules. You don't have to provide those details. What that means is technically you may not have to report your consulting fees. There are some exceptions. A big exception would be if the plan itself pays the consulting fees versus the employer paying the consulting fees. If the plan pays the fees, they need to report it. And then also if you're providing services to the employer of a general nature, not just to the plan, so you want to broaden out your consulting agreement to be basically consulting for the employer, not so much for the plan. That helps you to avoid having to file that Schedule C if you do indeed want to avoid it. So again, just some helpful hints there. One other thing to remember, and this gets into some kind of technicalities of ERISA, there's something called a funded plan. And under ERISA, a funded plan doesn't mean self-funded, and it doesn't mean fully insured. What a funded plan means is you have a separate account or trust set up from which claims are paid, or it's the way that the plan operates is out of one of these separate accounts or trusts instead of from the employer's general assets. If you want to avoid all the ERISA implications of all that stuff, Make sure you're having your self-funded plan set up to operate from the employer's general assets, and make sure that you have a POP plan in place to collect the premiums. If you do that, there are some ERISA mechanisms that allow you to avoid having to file a 5500 if you're a small employer, under 100 enrolled on the plan. And also, it helps you to avoid some other implications of setting up a trust. You want to avoid that stuff if you can. And sometimes we see certain self-funded arrangements where the TPA says, no, we set this up as a trust or as a funded arrangement, and you have to file regardless of size. Well, if that's the case, make sure you file, and make sure you keep on top of those 5,500 requirements for the plan. Let's talk about Section 105H non-discrimination testing briefly. I've mentioned this a few times. This is very different from your cafeteria plan testing. If you're familiar with cafeteria testing, there are 3 different tests that cafeteria plans have to meet under Section 125. Self-funded plans have 2 other testing components under 105H. There's an eligibility and a benefits test. And when you look at who's highly compensated, who's in that prohibited group that can't receive the better treatment or the better deals, that's the highest paid 25% of all employees. What does that mean? Well, that means 1 in 4 employees are highly compensated in most cases. And it means that you could have people making relatively low salaries who are still considered highly compensated. And you don't have all the loopholes that you can get with Section 125. You really lack any real good loopholes with 105H, and you want to make sure and just comply with it. Or like some of those employers that I talked about earlier, if you're not going to comply with it, understand you're rolling the dice. And if the plan turns out to be discriminatory under 105H, it's not the premiums that were paid that become taxable. It's a pro rata percentage of the benefits received by each highly compensated individual, which means some portion of the claims payments they received are now taxable. So let's take Larry. He makes $40,000 a year, but he's in the highest paid 25%. The plan turns out to be discriminatory. Larry benefited from that discrimination, and now Larry pays a percentage of whatever he received in claims. Larry had a heart attack, had $80,000 in claims. Let's say 50% is his pro rata share that he has to pay. He now has $40,000 additional in taxable income. He's just doubled his taxable income, all because his employer had a discriminatory plan under Section 105H. All right, take a deep breath, because that's a lot to take in, and it's really scary. The only good news I can tell you on that is that the IRS is somewhat hesitant about enforcing this, and you can kind of see why. But on the day when they decide to do it, Larry and a lot of other people could be in a lot of trouble. So keep that in mind with Section 105H. Next, we're going to talk real quickly about HIPAA considerations. I'm not going to take the time. Is there any subject more boring than HIPAA? Maybe non-discrimination testing. I don't know. But I won't take all the time to go through all the HIPAA stuff with you today, and I certainly want to leave lots of room for questions at the end. So let's just talk real briefly about the HIPAA considerations. Bottom line, your self-funded plan is a covered entity under HIPAA, and it doesn't have the benefit of an insurer to meet the HIPAA requirements and to have all the paperwork and everything set up. So you've got to set up a HIPAA privacy policy for any employer that's sponsoring a self-funded plan. It's non-negotiable. You have to have it. One of the reasons this is important is HHS is the one that enforces HIPAA. They didn't used to pay much attention to self-funded plans as covered entities. They spent most of their time, almost exclusively, all their time on providers like hospitals and medical clinics and insurers. But they didn't really get down to the self-funded plans too much. Well, now they're doing this on a regular basis. They're in what they call phase 2 audits, and they've been for a few years now. They've posted a wall of shame on the HHS website where they list forever those plans and those providers and those insurers who have fallen into the HIPAA trap and have gotten penalized, they'll post who you are, what amount you were penalized, why, what kind of rules you broke. It's all there. You can look it up. They don't call it the wall of shame. They call it reporting on their activities. Everybody else out here in compliance world calls it the wall of shame because nobody wants to be on that wall on the HHS website. Certainly not your client, especially when it comes down to paying lots of money to HHS for violating HIPAA. So make sure they set up a privacy officer, make sure they adopt a privacy policy, make sure they are distributing the notice of privacy practices and conducting training every year. These are things that the fully insured employer doesn't necessarily have to do. It doesn't hurt if they do it, but they don't have to do it. The self-funded employer has to do it. It's required, and they can go further. They really should look at security requirements, including policies, a risk assessment, implementing an action plan to close any exposure, and managing any suspected breaches or incidents related to people's data, and particularly health plan data, or PHI as it's called. HIPAA enforcement is ramping up, as I mentioned. Just a few other things to wrap up here before we go to questions. You want to watch carefully if you're transitioning employers into or out of self-funding. Run out and run in periods. You want to watch those closely because there can be some scenarios where employers get stuck with claims if they're not careful. So you want to watch that carefully. Also, and just be aware of it, that there can be some additional financial exposure on the transition in or out of self-funding. Also watch for potential COBRA issues. COBRA, like everything else, ramps up with self-funding, and there's not an insurer to be on the hook for those COBRA issues. The employer is basically stuck 100% at that point. Also, I mentioned earlier coverage gaps. The best way to avoid that is just have all the documents reviewed, ideally by compliance experts or attorneys who can find coverage gaps. That's what they're trained to do, and they can give you the language to eliminate the coverage gaps between stop loss and plan document, or things like the employee handbook, wherever eligibility, leave provisions, all those sorts of things. That's where you might find coverage gaps. You want to be super careful never to set up a self-funded MEWA. They're illegal in many states. They have compliance obligations. Unless you are Mr. Compliance or Ms. Compliance, superhero, don't mess with self-funded MEWA. If you don't know what MEWA is, you're one of the lucky few, and don't ever find out. I wish we had time to dive into it today, but we won't. PCORI fees, don't forget. I can't tell you how many employers call me and say, or their broker calls me and says, oh yeah, they haven't paid the PCORI fees. Now what do we do? And it's, been 6 years or something. That, I imagine, turned out to be an uncomfortable conversation with the accountant who I referred them to. Yeah, take that back to your accountant. Only they're going to be able to tell you what to do about that problem. And it probably turned into a lot of additional excise taxes, fees, and IRS penalties is my guess. But just stay on top of it and you won't have to have that conversation. Don't forget, when you come to employer reporting, there's a part 3 on the 1095 forms that the employer has to add additional information if they're self-funded that they don't have. What that means, that they don't have to do if they're fully insured. What it means is your ACA reporting might be a little more expensive, and just be aware of that. And you have to have a little bit of additional data, particularly about dependence on the plan. So with all of that said, first of all, thank you for walking through this presentation. I see we have several questions. I want to take time to address those and any additional that you might add to the discussion. Before we dive into that, just real quick, this is not a big sales pitch by any means, but if you have self-funded or fully insured clients or employers you're working with in any capacity and they need these services, NEDCOM is here to help. It's what we do every day, all day, and it's what we love to do, and we love to help you to succeed with your clients. And whether it's ACA consulting, health and welfare compliance, documents, 5500s, non-discrimination testing, all that's in our wheelhouse with compliance, including those document reviews that I mentioned. We also offer the actuarial services I mentioned, COBRA administration with lots of large self-funded clients in our book. HIPAA, we can cover all those HIPAA items with the exception of writing the security policies. Everything else is in our wheelhouse. If you need FSA, HRA, or HSA administration, that's us. Government healthcare, well, unless you are in the Bureau of Prisons, that's probably not something that you're going to call on us to do, but that's another area where we specialize. Just to give you a sense of how well-rounded we've become since exiting the self-funding TPA business. We've been around about 37 years now, founded in 1983. We're based here in Jacksonville, Florida. We have a regional office in Atlanta, but we're really nationwide in our footprint. And we'd love to work with you if you're not working with us already. If you are, we'd love to work with you more. Here's all the contact information. And that's as much of a sales pitch as I'm going to give you today. But let's look at some questions. And certainly if Charlotte or Tina have any other comments, you're welcome to chime in. And thank you again, Charlotte and Tina, for helping to make today's presentation possible. It's been my pleasure to spend this time with all of you today. Let's see, will we be talking about reference-based pricing and direct contracting? Unfortunately, no, but those are some hot topics in the self-funding world. And as you can see, that wasn't part of the presentation, but that would almost be its own presentation and definitely not on the docket for today. If the fully insured carrier has all the risk, why do they keep raising the rates? That's a good question. You know, they've got to make profit. Feels more like they hold the risk for up to 12 months, then unleash the pain. I love this. Thank you for this comment. This is great. Unleash the pain they cause right back on the employer. Yeah, you know, it's a tough business to be in as a fully insured carrier, and I'm certainly not going to say they shouldn't be in it. But you know, that's part of the reason why many employers go self-funded, is they just feel like it's unfair. So, you know, whether it is or not, we'll leave it to the carriers to talk about their own risks that they bear. Doesn't a carrier bear risk with stop loss, as most employers have? Yes, that's definitely a way to shift risk back to a carrier. And again, at the higher level, I think that question came in before we covered that in the presentation. We have many groups under 100, all self-funded, many over. Some even over 50,000 lives. Wow. Small employers need the help to get out of fully insured carriers more than larger ones. That's a good point. Yeah, there is a market for smaller self-funded employers, and that could be a great strategy. If you can find a way to get around the risk pooling being generally considered to be a problem at that size. So they could join a captive. They could go level funded. There are lots of options out there. They could go self-funded mech. But you have to be careful where the risks fall. And I'm not going to comment too much about whether those strategies are ones I like or not. I'll just say they're out there. And if you want to run down that road, well, now you're that much more equipped to know what you need to look at. If the group is over 50, they rate experience rated even if fully insured. So that is already accounted for in their rates. Yep. If they're old or unhealthy. So self-funding still makes sense. That's an excellent point. It really could if they are, if they're experience rated, then it could make sense. Yes. Good, very good point made there by that commenter. So thank you for that. Charlotte, Tina, I've exhausted the questions. Don't see any more, and just we'll open the floor for both of you if you have anything to add.
I really, with the HIPAA, it'll be interesting, and this is just my comment, no question. It'll be interesting how with COVID, and everyone seems to know about anyone who has someone regarding COVID. So it'll be interesting to see where this all plays out as far as being under HIPAA. As a stop loss person, you mentioned something that is very important, and it's contract. Looking at the plan document, stop loss policy. And contract is so important. Run in, run out. What does it mean? If you don't understand, ask questions and look at the policies. That's my editorial comment. Thank you.
Excellent point. Thank you very much. And on COVID, from a claim standpoint, most plans are having or had a good 2020 because a lot of people didn't do their normal doctor visits and things. But we're anticipating from an actuarial underwriting perspective, 2021 or maybe later could hit hard. So that's a factor to look at. If you're considering taking an employer self-funded, they could actually have a big claims year coming up, maybe 21, 22, where all those things that didn't get done in 20 and may not even get done in 21, depending on where we're at with national emergencies and pandemics. So that's a factor. You want to know the times. We should have added that to that slide on, it's not normally a consideration, but right now it is a big, big consideration. So thank you for those good points, Tina. All right.
Well, thank you, Derek. This was great. If people have further questions, please reach out to Derek. I want to thank my fellow board members, Charlotte and Michael and Joey and Meredith. We appreciate everyone's participation. Stay healthy. Namaste.
Thank you guys so much.
Thank you, Charlotte. Everybody have a great rest of the week.
Bye-bye.